one of the major features of the blockchain platform is immutability. So every single transaction that happens within the healthcare environment, within our system, is mapped or tracked on this ledger so that every transaction can be recorded. And that recording is completely immutable. So nobody could really go in and change or modify that transaction. And if they do, if an actor goes in to modify that, that will get tracked as well. So very quickly, you could see if anything was being changed. And so essentially the entire system is a trustless system. And in a trustless system, now all of a sudden you can have anonymous parties interacting, sharing valuable assets, never really knowing who the other person is, never having to really give up personal information. The other key feature of our platform is smart contracts. And so with smart contracts, essentially they're pieces of code that self-execute without the need for a middleman. So all of a sudden a patient can execute a smart contract. They can use their private key as a digital signature on that agreement, and that naturally signs off. So for the patient, the experience is incredibly user-friendly. They're saying yes or no, yes, I consent to sharing my de-identified data with researcher X. But on the back end, they're basically these agreements that self-execute. And so again, you don't need to have different actors, different middlemen, different parties interacting with the system. You can have the patient being fully in control of sharing their data with their practitioner, sharing their data with a researcher, and patients can also receive incentives for sharing that data. And these incentives can also be sent to the patient through smart contracts.